Assemblywoman Gunther, thanks so much for being on New York Now this week.
Well, it's great to be here, and I'm very honored that you asked me to talk about mental health today. Something that, as a nurse and as somebody that has worked with a lot of the mental healthcare agencies, that we know that we've been long starved, and I think the COVID virus has brought this really into the forefront about how mental health hasn't really been supported the way it should be.
So I want to talk to you about mental health and COVID-19, but let's talk about the state of mental health in New York State overall first, because as you and I both know, funding for mental health services really wasn't as much as it could be before COVID-19 struck, and now we have this big budget deficit in New York State already. Talk to me about the state of mental health in New York State pre-COVID and how the disease has changed that.
So what I would say is that for a very long time, mental health, they recognize the need for health care, but part of health care is mental health. And we have been financially starved for years. If you have private insurance and you have psychiatric coverage, it's minimal. And often the co-payment is exorbitant. When we have a patient, and I've had a lot of parents that I've worked with over the years, that their child needed an inpatient stay. Like any other medication, you have to start a medication and observe the efficacy of that medication. They have these children in and out in no time short. They only collect the money, but we really don't see how effective the medication is. So the length of time is too short. The insurance companies charge a very high premium. We don't get the care that we need for our children, for people that are suffering from mental health. And hello, Governor Cuomo, the President of the United States, we are now at a time that we're going to see more and more people traumatized, our children in school that haven't been in school, that are sometimes home alone, that they don't have food. We're going to need psychiatric care, mental health care, counseling more than ever in our schools, in our communities, everywhere. In our workplace, we need it. And you know what? I've been yelling and screaming for years, and I know I sound emotional, but it's just not fair.
You know, the mental health of, I would argue, everybody has taken a toll during the COVID-19 pandemic. But I think that's especially true for frontline workers and especially healthcare workers that have had to treat these patients coming into the hospital, see unprecedented amounts of death just right before them on the job. And that's going to take a toll on their mental health. You have a bill that would form an advisory council that would look at the mental health of essential workers. Tell me how that would work and what they would be looking at.
So I think it's important to create a collaborative group so that we have input, number one. But when I say let's create it, I want to create it and then get recommendations, and I want a timeline so that it doesn't go for a year, a half a year. Really, we need to really address this problem right now. And I think the only way that you can get the kind of treatment that folks need is by having a collaborative group that work in different areas that have input into a system that we could create that would really be holistic and serve the population of New York State. And especially now, it's the healthcare workers, absolutely. The death, the dying, the supportive families. And so they need some help right now. And I think Governor Cuomo, we need this money right now. We don't have to give any more exemptions to big business, to companies. We don't have to create startup companies, because right now there's money that we have in economic development that we're not going to be able to use because at this point we're at a standstill. So take this money and put it someplace that will help the people that are suffering right now, that are children who may suffer in the future, that will never get over this, that are going back to school and don't know what it looks like. We need social workers, we need nurses in our school, and we need mental health in our school, and we need to do it right now.
Right, the state is facing this multi-billion-dollar budget deficit. It was before the COVID-19 pandemic even happened, and this has just made things worse. How do you get the message across that the state should preserve funding for these mental health care providers when Governor Cuomo is looking at cuts across the board everywhere?
Through people like you that will put this and talk about it till you're blue in the face. Not just me. Talk about a family member that is suffering right now and has the person at home and sometimes doesn't have the access to the medication they need. There is no exception. It doesn't matter if you're rich or poor. Children are scared. I'm scared. You're scared. I mean, it's just a really hard time for all of us. And Governor Cuomo, the Senate, the U.S. Senate, the U.S. Congressperson, please bring money back. No, not just talk. Let's have action. You know what? The public is sick of cheap talk. We need action, and we can't wait this time.
You know, before I let you go, you represent a part of the state in the Hudson Valley that we don't hear too much about too often. We hear about cities like Albany, of course, New York City, Long Island, Buffalo, the major cities around the state, but you represent a part of the state that's sometimes forgotten. Tell me about the state of your district right now and what your community is experiencing.
I mean, they're experiencing job loss, hunger, family loss of life. People sometimes have this vision that you see trees and you can breathe fresh air, that things are all right. Well, they're not all right. They're not all right. We have homeless. We have people living in dire conditions. We have children that are hungry. We have kids that we feed every Friday afternoon. Our teachers have a backpack program and send food home for those children. Where is our, I've tried and I'll continue trying. I know, don't give up. But you know what? When we talk about the Hudson Valley, we're up here. We are the people that are suffering with, at this point, people's loss of jobs, no transportation. You name it, we got it.
All right, Assemblywoman, thank you so much for your perspective on this. I really appreciate it.
Thank you so much for listening to me, and I certainly appreciate it.